I would like to personally thank Mr. McHale for his generous donation to fund my research. Your contribution enabled me to have a unique, life-changing experience where I was able to explore lab work while focusing on a topic that I find interesting and important. Good afternoon. Today I'm going to be presenting my research on the identification of bacteriophages that target Staphylococcus aureus MRSA strains. So to begin, what is S. aureus? This is a bacterium that normally grows on people. It's named this because aureus is gold in Latin. If you look at the petri dish above, the bacterium growing on the cultures are gold, just like why S. aureus is named gold in Latin. Even though it is golden, it's not always a positive thing. For example, this bacterium can sometimes cause an opportunistic infection, which is where it infects people. It can cause a disease such as pneumonia, meningitis, or sepsis, and it can be dangerous. In addition, it can also develop antibiotic resistance. This is where the bacterium is no longer effective or less effective to standard treatments such as antibiotics. This makes it much harder to treat and much more dangerous. For example, in the case of the man on the screen, this was a scientist in California who had a Staph aureus infection. It was antibiotic resistant, so his treatment did not work. Fortunately, the research team, including his wife, who was also in the picture, was able to find different alternative therapies to treat his infection. One of the avenues that they pursued was the phage avenue. This is using a virus to treat his bacterium. These evolved evolutionarily to be able to treat these infections, and luckily for him, it was successful. And this is the basis behind why I decided to try to pursue this research here in New Haven. So I first took these 7 clinical strains, which I got from a vendor online, and these were isolated from patients who had methicillin-resistant Staphylococcus aureus or MRSA infections. From here, after these were grown, I then went out into the environment to collect samples. The first set of samples was from the Branford Trolley Trail in Branford, Connecticut. Here I collected various mud samples, water samples, and ocean samples with the hopes of finding some phages that can target these bacterium. Additionally, we also collected sewage samples from the Branford Sewage Treatment Center and also from the Meriden Wastewater Treatment Plant. The reason for collecting sewage samples was because they are more closely related to people, so there's a higher chance of finding a virus here in this setting. After these samples were collected, all of the particles were taken out and they were combined with a phage buffer. This provides all the nutrients that these viruses will need in order to grow. In addition, it was combined with a bacterial culture from one of the MRSA strains, which is resistant, and then poured onto an agar plate. The reason for doing this is to provide the bacterium a medium that they can grow on, and it also provides the viruses something where they can grow on as well. When looking at the results, you can tell a positive result from a hole in the agar. This indicates that the bacterium grew on the plate and also that there are phages present and these viruses kill the bacterium. If you look very closely here, one of the examples actually had a positive result. This is from the Branford Sewage Treatment Plant. This was the first sample that we collected there. It's a little bit difficult to see, but if you look closely, there are many, many, many tiny, tiny dots here, all of very different shapes and sizes, which indicates that there are viruses on this plate that are actually growing. Using these results, you can definitively say that there are phages present here in the New Haven area that have the ability to target and treat, potentially, Staphylococcus aureus. Follow-up on this research would include isolating these phages, testing them against the other 6 in the panel, and then potentially sequencing it to see if there is something novel. I would just like to thank Mr. McHale for his donation. I'd like to thank the SURF team for helping me out with my research, and of course, I'd like to thank Dr. Clark.